So we're just going to talk a little bit about respect. Now, here at the Medical Debate, I'm sure we've seen you guys. You guys are very, very respectful for all the sessions that we do. And you guys are very good at maintaining a sort of professional air about things when you're looking at these sometimes difficult ideas and topics. But why is it very important to talk with respect when you're talking about when you're talking about behavioral disorders? I've basically covered it, so I'm not going to ponder too long, but it's just that, there are people living with these, and it's no, but we're going to discover some of them are by no means illnesses, but it's very important to pay respect to people who might find these being difficult in their lives. Okay, so the first one we're going to talk about is autism. Autism is actually very important. It's very important to know that it's actually not a disease. If you're autistic, it just means your brain works differently to other people's, but it does not mean that it is an actual illness that needs to be cured or there's something completely wrong with you. People with autism can actually live full and long lives. And if you're born with autism from birth, you will have autism throughout your life. However, it is manageable. Can anyone name any other diseases where if you're born with it, you have it for the entirety of your life? It's a very simplistic question, but I think it's very important to have sort of these cross-curricular links where you can sort of come up with ideas throughout the entirety of the sessions that we do. While you're coming up with them, I'm just going to carry on with the presentation. People with autism may find it difficult to communicate with other people, especially socially. They might miss certain social cues, or it might be difficult for them to understand how someone is thinking or feeling at every given moment. It is also possible for them to find bright light and noises quite uncomfortable. By this, we mean seriously bright lights and, very loud noises, and basically something that's not your normal everyday level of noise or sort of intensity of light. It's quite possible that they also have a delayed understanding. It may take them a bit more time to understand something. And it's also, by no means does it mean that their intelligence is completely affected, or if they're completely unable to understand information. It just means that the brain works a bit differently, which means that they intake and understand information sometimes at a slower rate. It's also quite common for people with autism to sometimes say the same things or repeat them over and over again. That's, again, just because their brain works differently. But, you might have noticed this in people who you might know who have autism. Tourette's, someone says Tourette's, someone said dyslexia. Yeah, yes, I mean, I think those are both diseases where if you're born with, not diseases, but they're behavioral disorders that if you're born with them, you will have them for the rest of your life. I was thinking more on the lines of, for example, diabetes or AIDS, etc. But yes, you are correct.
Right, okay, so we're going to talk a bit more about autism and related disorders now. So first of all, we've got an image on the screen here. So can anybody kind of explain what this image has in terms of its relevance to what we're talking about today? Just put it in the chat perhaps, and then we can move on. Okay, someone's put perception. That's not quite what we were thinking about. Barrier, not really. Perhaps we'll just we'll tell you. So then if you move on the slide. It's about a spectrum, and although that image probably wasn't the best representation of a spectrum, it's very important to know that many disorders like autism do exist on a spectrum, and that means that they are very different for different people, and people have symptoms which express themselves in different ways, but can still be the same disorder. And this is, you may have heard of people who have autism as being referred to as on the autism spectrum. And this just means that there's no, single type of autism, and that everybody's autism is different. And I think that's very important when we're talking about these topics, because although we're kind of telling you some of the symptoms or perhaps some of the characteristics of people with these disorders, it's important to note that these are different for everyone. And there are some people who may be diagnosed with autism, but they don't express these symptoms. They may be able to do things more easily that other people can't, or they might find certain tasks more challenging. So yes, it's very important to know that it's different for everyone. So for autism, the medical name for autism is either ASD or ASC. And does anybody know what these acronyms stand for? It's just, you know, a useful piece of knowledge to have. You can just put it in the chat if you'd like. Yeah, so someone's put autism spectrum disorder. Yeah, that's ASD, that's what it stands for. And ASC, it's quite similar, basically more or less means the same thing. Does anyone know that one, or anyone want to have a guess?
It's just the last words that is different. It's basically the same thing.
Okay, well, I'm not sure if you, you know, some of you might be trying to think about it, but it's autism spectrum condition is what it stands for, which is more or less the same thing, but these are just different terms which can be used to refer to autism, and the fact that it's on a spectrum, that you know, indicates the fact that it's not just a single type of disorder. It's, you know, it can be many types of disorders which all exist and all manifest themselves in different ways. And it can exist in conjunction with other disorders such as epilepsy, anxiety, ADHD, or dyslexia. And indeed, many people who do have autism, some of them may have an increased risk of having other conditions, for example, epilepsy. And that's why it's very important that people with autism are given the correct, not necessarily treatment, but just kind of they're given the correct requirements and conditions for them to be able to work and learn, for example, for autistic children. Because as we said before, there is, you know, autistic people are able to have, you know, fairly normal lives. It's just the fact that their brain works in a slightly different way. So it's not like this is a medical condition which needs to be treated in a different in a way similar to a disease. It's a disorder. So yeah, perhaps we'll move on to the next slide now. So another thing we're going to, yeah, so Sivan, I think you're going to take this one actually.
Yeah, so this is actually Asperger's, and actually you may have seen it in a previous slide. We did say that Asperger's is a type of autism. On the right is the Asperger's awareness ribbon, and actually that's quite an important symbol to be aware of that, especially if you're going into the medical field. It's quite important that you are supportive of all people with these illnesses and make sure that you know how to help these people out. Asperger's is commonly defined as a type of autism which is used to describe someone on the autism spectrum with average or above average intelligence. And as you can see on the next slide, people with Asperger's, Asperger's does not affect their intelligence. And in fact, actually, quite often, there are quite a lot of people that have Asperger's and above average intelligence. As you can see in the slide there, actually, in the top paragraph, it does say that in one study, it was shown that people with Asperger's have on average a greater intelligence than those without Asperger's. Now, obviously, this study, you know, there's lots of things to take account here. Obviously, the amount of people with Asperger's is a lot less than people without Asperger's. Not only this, but, you know, the proportion therefore would be smaller. Fewer people would have a higher intelligence. And, you know, again, we don't know exactly what they use to measure intelligence. It could be IQ points, etc. But it's very important to realize that each study has both its shortcomings and advantages, which are very important to consider when looking at a study or quoting it for information. The next part is that it says it may be difficult for someone with Asperger's to read social cues or interact socially as it is. So we often take the social skills that come with growing up quite for granted, but it can be difficult for people with Asperger's to understand social cues and respond accordingly straight away. For us, it's more of a acquired thing as we gain experience. If you don't have Asperger's, but if you do, then it may be something that you may have to learn, which is a lot more difficult. That does not mean that there aren't people that can learn it, and there aren't people that you know, that they won't be able to maintain social cues, but it's just a bit more difficult for them. And you know, if I think a few celebrities, if you look online, I'm sure you can find some celebrities who have Asperger's, and they've been honest about it, and they've, you know, they've told the world about it and explained their difficulties. But that's a common association with people with Asperger's, that it might be a bit more difficult for them to interact socially. As children, people with Asperger's have been shown to show a smaller range of emotions. So I think there was a study conducted which actually said that parents were quite worried with certain children because their children didn't portray happiness or sadness, or the different emotions as a normal, not normal, but a child without Asperger's would. Um, it's very important to note that sometimes, most of the times, these symptoms or these sorts of side effects do improve over age, but they can be managed as well. And as with autism, it's quite common that they may repeat certain things.
Okay, so we're going to talk a bit more now about some other disorders, more specifically ADHD and dyslexia, which again you may have heard of. And it's important to mention that although these are sometimes confused with each other, they are two different disorders, although some of the kind of characteristics of of some of them might overlap. And there are often children or people who have both of these disorders or exhibit certain symptoms of both. So if we're going to talk first about ADHD, and this is a disorder where most children are diagnosed, quite young, between the ages of 6 and 12. And it does have some hereditary factor, but the cause is still unknown. And there is a lot of research going into how these are kind of genetically inherited and how, like, where on genes they appear. There isn't a cure as such, but it can be managed with appropriate educational support and sometimes medicine. And of course, people with ADHD, many people think that more research into the kind of genetic, the genetic cause of ADHD could perhaps, be a negative thing, because many people are concerned that this might make it seem more like a disease, when in fact it isn't a disease. It's just a disorder which requires, educational support, emotional support, but it doesn't limit a person's capability in many ways at all. So the NHS says about ADHD, other factors suggested as potentially having a role in ADHD include being born prematurely, having a low birth weight, or smoking or alcohol or drug abuse during pregnancy. And we've had a look at pregnancy in a previous session and the role that these factors can have on an unborn child. Sometimes they can damage a child's brain, or they can damage their physical appearance. But in other cases, they can have effects on the brain which might not necessarily be negative, but just alter the way that children think and approach the world around them. So we're going to talk now a little bit about dyslexia, which is a similar disorder, but it does also, it has many differences. So it's quite a common behavioural disorder, and it can lead to people having difficulty with reading, writing, spelling, and sometimes mathematics, but your overall intelligence is not affected. So, it's possible that some of our audience might be dyslexic, and I'm sure you will know, even if you don't have this disorder, that it's different for each person. Some people do find certain things difficult, like reading. Other people might not find these things difficult, but they might find spelling and writing more challenging instead. And for example, a common feature of dyslexia is inverting similar letters, including B and D or P and Q, for example, and the order of letters in words might be confusing. And this is particularly noticeable in younger ages. But of course, additional support can mean that people with dyslexia are able to overcome these challenges. They often
Sorry, I think Shivas might have frozen there. Shivas, I don't know if you can hear us or not, but you're frozen. We can't hear you. Maybe try leaving and rejoining. Either way, so I think I'm going to carry on until we can hear Shivas again. So with dyslexia, actually, it's quite common that it might be difficult for them to read or write. And actually there is a way to diagnose this. And one of the tests for this is to read words that are a tiny bit more difficult to read, or maybe invert the word and see if they can read them properly, etc. I mean, the testing for dyslexia, I'm sure you might have seen it in a doctor's office, or you might have seen it somewhere else, but the test for dyslexia does sort of reverse engineer these symptoms and look at, if they can read. For example, I've heard that one of the words that they see is the word sword. If they spell it back, so they'd write the word backwards and then they'd invert it, and then they'd say, can you read that word? If someone's dyslexic, it's quite common in that they can't, and that makes it, that kind of thing is very difficult for people. I mean, I'm sure you guys are thinking, it's quite difficult to read inverted words anyway, but obviously there is a huge difference between someone without dyslexia and someone who may have dyslexia, and so therefore has an impaired ability to read and write, inverted words. Shivas, are you back?
Yes, sorry, I think I'm not quite sure what happened there, but I think there was just a problem with the computer. But yeah, sorry, I'm back now.
Yeah. Okay. Yeah, I'm just going to finish the slide, and Shivas, you can take over. So normally with dyslexia, also you can have, it might be possible for people who are dyslexic to have difficulty in planning and organization. So actually, we're going to look at a ethical issue at the end of this presentation where, students in primary schools, for example, if they may dyslexic, or maybe even secondary school, and obviously, as we said, a lot of these symptoms do improve over time. But then if they're in school, they might be, teachers might get impatient with them, etc., if they've not been diagnosed. And so it's very important for the diagnosis to happen, and it's very important for people to know, especially with, as Shivas mentioned, educational support, educational groups, awareness. It's very, very important for us to know the symptoms and how we can aid those with these symptoms. Okay, so we're going to talk about SENCO, or its special educational needs coordinators, which are present in most schools. And actually, we will put the link of this website in the. We will give you the link of this website, but basically, if you type in SENCO, it should come up. But basically, this highlights when to consult a special educational needs coordinator within a school. So commonly, it's when someone's been diagnosed with one of the things that we've told you about today, one of the educational disorders. It's quite common, and actually I think it's recommended for parents to mention to the school that their student has an educational need, and this way the school can aptly prepare for that student's education, because regardless of whether they have educational needs or not, it's very important to treat all students with the correct educational needs and make sure that they're learning at the same level. If the needs are likely, as it says, if the needs are likely to be more than a minor concern, then that can be dealt with by the class teacher. Special educational needs coordinator may observe the child, talk to other staff members, and look at any records, and that may indicate difficulty. So it's quite important for the school to know about this. And actually, again, we're going to be talking about this later on. Obviously, you can probably imagine the scope of problems that could occur if a young child has any of the special educational needs that we've mentioned. It's a lot more difficult for them than it may be for an adult. And the role of a special educational needs coordinator, and actually if you look at this first sentence, it's quite similar to the role of almost all good listeners and people who care about someone who have special educational needs, or a doctor especially in this case, would be to listen to others, especially parents. So how can you help, Shivas?
Yeah, so we're going to ask now, how can you help as people, as fellow classmates, as future doctors? So, we assume that many of you will be wanting to go into the medical field, and therefore it will be as important as doctors to be able to, communicate effectively, and to be able to recognize people with, disorders such as these, and be able to, accommodate their needs. So what we want to ask you now is how the specific things you think as a doctor you should do, or as a person you should do if you're in school, what you can do to accommodate the needs of your classmates. So yeah, we just want to ask you about that and kind of any ideas that you have. So someone's already put in the chat, be patient when they are speaking because they may need more time for simpler tasks. Yep, that's very true, and that's something we said before. Some tasks some people take for granted. They're able to talk quite quickly, or be able to listen quite quickly, but sometimes people with behavioral disorders might not be able to do that. So it's important to be able to, speak clearly and listen to what they're saying, because occasionally they might struggle to get their views across. Anyone have any other ideas? Perhaps some which are more specific to a medical setting. Yeah, the second point someone's mentioned is something which I was thinking of just now as well, and I think it's also really important. Whilst it's important to talk, perhaps slowly and clearly to someone, you should never treat someone like they're a baby or talk condescendingly to them, because that undermines the fact that they're still, a human being. They're not, in most cases, mentally behind, or they're not unintelligent. They're still able to understand what you're saying and everything. So it's important to not be condescending to people, to treat them like humans, but at the same time make sure that you're speaking clearly and listening as well. But yeah, that's another really good point. And also that's especially important in a medical setting as well, because as a doctor, it's important to build trust with the patient, to communicate with them, to understand, to make sure that they feel comfortable. And if you're being condescending to a patient, then that's not going to help that. That's going to perhaps think that, if you are a person with a disorder like this, you might think that a doctor is not taking you seriously. They don't really think you understand what's going on, when in fact you may have a good understanding of what's going on. So, in a similar vein, it's also important for doctors not to kind of dumb down the information that they're giving, to not simplify it just because a person has a disorder like this. It's, equally important for all patients to be given the correct information, to be given accurate information, and to understand what's going on in terms of their treatment. Someone has said, know how to communicate with patients, because certain things might need to be made more explicit, as they may find it difficult to read social cues. Yeah, that's very true. And especially if a patient doesn't really know how to express the kind of the treatment they need, or they're not really sure how to express the pain they're feeling or something like that, then it's very important to know how to communicate with them, to kind of make sure you can get that information from them whilst ensuring that they're as comfortable as they can be. They might find it difficult to read social cues, to communicate that information across, but as a doctor, it's important to make sure you listen to them and really make sure you understand how they're feeling and what they need. Someone has said, if need be, take time to debunk myths and correct stereotypes. Yeah, that's very true, and that links to what we were saying before about being condescending. There is a sort of stereotype around people with these conditions, that they are, they have low intelligence, which is, as we saw before, not necessarily, or in most cases, not true. So it's important to treat them as normal human beings, whilst also accommodating their needs. But other stereotypes and also stigmas which surround these people, it's very important to avoid those as well. It's important to treat them normally, to ensure that you're not thinking of them as having diseases. There's nothing wrong with people with autism. It's just the fact that they interpret information differently, for example. So it's important to, correct those stereotypes and ensure that you're helping other people who perhaps are more neurotypical, that they're also respecting these people and not trying to not promoting these negative or harmful stereotypes. Someone else has said we can listen well to anything they communicate about what they struggle with, and make accommodations for them, especially if they struggle communicating. Yeah, that's very similar to what we've said before as well, but it's completely correct. We should try and make accommodations for them when they're communicating. Do you have any specific ideas as to how someone could go about doing that, or perhaps even in a medical setting, how someone can try and do that? So if you do, please do put those in the chat as well. Someone said, emphasize with them when they are struggling to communicate and ensure that they feel safe. Yeah, that's very important. And you don't want to, if you are trying to help them to communicate, it's also important not to force them to communicate if that's not what they want. If they're struggling, but they feel uncomfortable sharing information, then it's always right for a doctor or anybody not to kind of force them to to talk and to respect their, personal space, respect their ability to, feel comfortable, and ensure that they feel safe and comfortable before they do communicate any information to you. Um, Someone said, be mindful when talking to children versus their parent. At the end of the day, it's the child's care. So making decisions without the child involved is not appropriate if they can understand their condition. Yeah, and I think that's true for all patients, for all conditions. It's very important that if it is a child being treated, that they are fully aware of what's going on, even if they may not really fully understand what is happening. And I think that's especially important with regards to people with these disorders, because again, doctors might feel that if a child has a disorder, then they're not really capable of understanding what's happening to them, when in fact they in most cases are. Someone has added, we should also make sure not to dismiss their symptoms and feelings. If they come with a family member or friend, make sure we are listening to them as well. Yeah, that's it's a similar point to above, but absolutely right. Someone said, talking to the parent instead of the child because the child has disorders can be very condescending. Yeah, so you added on to your point from before. It's very, very true. We don't want to be condescending. We want to be clear and accommodating. So someone has said, a way to accommodate is to use more audio resources than leaflets if they struggle with dyslexia, for example, or to make sure you don't only give them resources that require a computer to access. Yeah, I think that's a really good idea. And a lot of information that GPs provide, for example, is in the form of, leaflets, but these, of course, might not be so accommodating for people with dyslexia, for example. And similarly, people who have autism might, for example, prefer, pictures or drawings or something similar to that rather than text. That's just, one example. And of course, that would be different. But I completely agree with you. I think that a variety of resources, perhaps, audio resources, videos, as well as text, is a really good way of communicating information to patients, to children especially, if they have disorders. So that ensures that they can understand all the information, all the treatment that is that's a possibility, whilst also ensuring that their needs are accommodated. So yeah, thank you everybody. I think those are some really good points, and hopefully now you you will try as well. We can all try to accommodate people who have these disorders by doing some of these things.
Yeah, so we're going to talk about one ethical dilemma actually that I came up with. And I have to say, it's quite difficult to come up with ethical dilemmas in this topic, because the thing is, although it's very common, we have learned, obviously, I'm not saying there's not work to be done. We have learned to include people with behavioral disorders as much as we possibly can so far. And there is still work to be done, but I think we're making good progress. Not only that, but there are lots of possible ethical concerns, and it's I don't know, I found it very difficult to find one that was apt for this situation. So I came up with this. Imagine a student in your class, so it could be primary school, secondary school, but in this case, we're going primary school, has ADHD. We talked about ADHD in an earlier slide. Therefore, the student may find it difficult to concentrate, but the student has not yet been diagnosed with ADHD. If the student is being disruptive, then it is predictable the teacher would be upset with the student. However, if the teacher scolds the student, they may feel helpless. Therefore, whose fault is it that the student has not been tested? So think about that for a few seconds and put your answers in the chat. And also look at the title of this slide. It's very important to think about this, because would the teacher be angry if they knew that the student had ADHD? Would there not be a situation where the student would have to get restless if they had been tested? Maybe the teacher would have made some prior arrangements. What kind of situation is at play here, and what different factors need to be considered? Because you need to think, is it anyone's fault? And if it is, why? Does anyone have any ideas?
And also, I think a question perhaps we could add on to this case study is, when we're discussing teachers scolding students, is it right for a teacher to tell off a student who has a disorder like this when it might be particularly harmful or discouraging to these people? Or, is there a different way a different way teachers should react to these students if they are being disruptive?
Yeah, so someone said in the chat, it is not solely any single person's responsibility to diagnose a student with ADHD. The parents, teachers, and doctors all work together to make sure the child isn't being negatively impacted. However, sometimes it is difficult to diagnose children. For example, girls often have very different ADHD symptoms to boys, and the teacher may have not learned about these symptoms. That's quite possible, but I think that's a good answer. But you have to think of the idea. Think about the question at the top of the slide as well. Should it be compulsory for all primary school children to be tested for all behavioral disorders? Obviously, the teacher may have not learned these symptoms, but it's quite possible that the doctor should know the differences and all the symptoms possible for both boys and girls. And so it's very important for us to think, maybe if she had been if the student had been tested before coming to school, then these prior arrangements would have been made uh, beforehand. Someone's raised their hand. Please feel free to speak out loud. Oh, okay, it's fine. If you want to speak out loud, feel free to. There's no problem with that. Could teachers be trained to recognize symptoms of children on the spectrum and recommend they be tested? That's a really good question because you have to think about that. Obviously, teachers are in charge of students, their welfare, and their education, and so it makes sense for them to know about this. But then also, you have to realize that, as we said, it's a spectrum. So every single all people with autism are different. They have different symptoms. They have different versions of the same behavioral disorder. So it's very important to think about this because is it possible for someone not in the medical field to learn something which would be learned by professionals normally only in the medical field, in that case. um Not only this, but if you sorry, maybe the maybe the teacher's fault because the teacher sees the child most when they need to concentrate, so it's more obvious. However, maybe scolding can be effective, as although they do have a valid reason, it is not appropriate in the working world, so they are preparing them for the real world. That's quite possible. Although I feel like that tough love sort of idea probably wouldn't work in a primary school. I see what you mean, that you're preparing them for the real world where not everyone will be so understanding and be so tolerant. But I feel like in primary school, maybe it should be more of a gentle approach. Obviously I'm not a teacher or anything, so I'm not sure. But I don't know. It's not a bad idea. When a mother gives birth and there are complications such as premature birth and low birth weight, then doctors should keep an eye on these children and possibly test if a birth is normal and healthy and there may not be a pressing need to rest. So I don't get that, Shivas.
Yeah, I'm still a little bit confused about that. I'm not sure if you could perhaps elaborate a little bit.
Could you elaborate, please? Um, all children do go to a GP at least once for checkups physically, listening to their lungs and making sure broken bones are healing well, etc. So it's behavioral problems should also be considered during that checkup. That is a good idea, yes. And obviously the obvious downside to that would be the cost, but maybe that is something that the government should implement, is in every checkup, not only should they check for physical disorders in the checkup, but also any behavioral disorders. That might be a good idea. If all children were tested, it may be possible for a child with a disorder to get clarity on their condition early on and be less confused. So some sort of screening process for the autism spectrum may be a good idea, so people can learn to manage their situation early on. That's really clever. Actually, I read this article about this person who didn't find out they had autism until after they were certified as a doctor, and throughout their life, they've wondered why it was so difficult for them to get on with their studies and why they found it so difficult compared to everyone else. And then afterwards, after learning about it in medical school, they realized that they had it, and then they had a checkup from an actual professional, and they were very surprised. I was honestly very impressed that, despite having autism, they still managed to become a doctor. And that's really, 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 it's a testament to the fact that everyone has a different type of autism, and it doesn't necessarily impact your intelligence, but it would have been so much easier for them had they known that earlier on. Maybe it is the individual's responsibility to reach out for help if they're on the lower end of the spectrum, because it's less obvious for teachers or parents to get them tested. That's a good idea, but then think about it for young children when they don't have any concept of disability or that sort of disability, or any sort of disability which is not physical. Would that sort of be applicable? And last point for the day, it could be the guardian's fault as they have more exposure to the child's possible symptoms. Some might believe that the child do not have a disorder, perhaps because it is a scary thing for parents to accept, so they tend to dismiss it. So the next person responsible for the child, needs to act on it, which in this case would be the school. That's actually a really good point. I'm not entirely sure what the legal side of that is. I think there is some sort of law saying that the teachers can recommend it or something of the sort. But I think that's a really good idea that, it should be sort of everyone is trying to take care of the same children as much as possible, especially when they're responsible for them, as a teacher would be. So I think there's a really good point, and I think those really encompass the sort of wide array of difficulties that someone with autism or any behavioral disorder could run into. Shivas, what do you think?
Yeah, I just wanted to add on actually to that last point. I think that's a really, really interesting comment that you've made there, and I think that's especially true. In sometimes there are parents who come from certain cultures who are not as exposed to these kind of disorders. They might not know so much about them, and they might have an increased stigma against them, and that can be quite damaging for children of these parents who have these conditions, because they're not perhaps able to receive the support that other children might from their parents, because they are different. And as you've said, it's very important in this case for teachers to be able to recognize children like this, and to be able to support them when they might not necessarily receive similar support from their own parents. And also, it's important more generally to educate children about these disorders, so that they're able to recognize themselves that they have them, and they perhaps need increased support, and that perhaps when they have their own children, they're able to give them that support as well. So yeah, thank you very much. And actually, there's one more comment that's just been added. Someone said, I was trying to say that things like having a low birth weight and being born prematurely has connections to ADHD, so doctors and nurses should keep an eye on and test those children when they come of age, instead of just testing all children. Yeah, okay. Oh, I understand what you're saying now. Yes. So it's similar to what we mentioned before. There are some physical characteristics of babies which link to these disorders, and therefore, these these children should be kept an eye on, so that they can be tested earlier on. Yeah, I think that's important, but at the same time, of course, there will be a lot of exceptions to this. So there will be children who aren't born prematurely who will have autism, or they might be at a different places on the spectrum. So although I'm sure doctors will take that into account, it's also important not to solely base their judgment on that. And similar with parents and teachers, anyone can have autism, anyone can have ADHD, and to different degrees as well. So it's important to keep an open mind and be prepared to combat or support students, and combat any stigma surrounding them, to ensure that all children who have these disorders have a healthy and happy upbringing, and have all the support that they can get. So yeah, I think that's all I wanted to add on, but I think everyone has made some really good contributions today, and I think we've more or less finished now, actually. So thank you everyone for attending today. Hopefully we've helped you learn a little bit more about these disorders, and also how you can play your part in removing the stigma surrounding them, and supporting people who do have them. You might know some people yourself who have, who are on certain spectrums. So yes, please do, support them, but at the same time respect the fact that they're human and that they have, being autistic is not their only characteristic. Everyone has their own personality, everyone is different, and therefore it's important to treat people differently as well, and treat people for who they are rather than just some, symptoms out of a textbook. So yeah, thank you everybody for attending. Hopefully we've helped you understand this issue a bit more. Please do contact us on themedicaldebate@gmail.com if you want to ask us any questions, and also we'll add you to our mailing list so you can receive emails for future sessions. Please do DM us on Instagram as well for any questions you have, and please do follow us there as well. And also we have a YouTube channel, The Medical Debate, so we'll be posting all our videos from our sessions up there as well, so you can catch up on any that you've missed. So yeah, thank you very much, and we'll see you next week, hopefully.